All right, I'm here at Allen Pond in Bowie, Maryland, and let's check out the view. Now, when we first saw this city, I thought it was Bowie, like David Bowie, but I was corrected. It is not Bowie, it is Bowie, Maryland, and we are passing through here. We just came from Washington, D.C., and this is our stay in Maryland. But you're not here for that. You are here to learn how Medicare works in Maryland, so let's talk about it. Let's start with the Medicare Supplement plan side of the conversation. So when we talk about Medicare Supplement plans, here in Maryland, you are a newer GI state. When we talk about GI, we're talking about guaranteed issue. What that means is the ability to go on a supplement plan without needing to go through medical underwriting. So here in Maryland, a more recent law was passed to where around your birthday, you would be able to switch supplement plans. Either you can go from a like to a like plan or a like plan down without the need to go through medical underwriting. And this is important because medical underwriting leaves the opportunity open for you to either be charged higher rates or be denied completely. So here in Maryland, if that's something that you would want to do, you have 30 days from the first day of your birthday month to make a change, and then you'd be able to switch plans. So why would somebody want to do this? Well, if you are on a supplement plan G, for example, and we'll talk about this, but certain insurance companies' rates increase faster than other insurance companies. Now, a G plan is the same regardless of which insurance company you get, but they don't charge the same amount. So let's say you're with an insurance company and their rates are increasing faster than others, and you want to switch from one plan G to still a plan G, just with a different company. In other states that don't have a GI rule, a guaranteed issue rule, you would have to go through medical underwriting. But here in Maryland, around your birthday, you can make that switch with no medical underwriting, no questions asked, and you will be approved for that. Going from a G to a G, or you can go from a G down to an N. You can't make that same switch up. So you can't go from an N up to a G without medical underwriting. You can still try that, but you would have to go through medical underwriting if you wanted to do that. Now, the fact that you are a newer guaranteed issue state is going to tie in and the reasoning here around your rates here in a second. But before we get to that, it's important to know that you're an attained age state here in Maryland. Attained age means that your plan rates are based on the age that you have attained. So let's say you go on Medicare at 65 years old and you get a supplement plan. Well, as soon as you attain a new age at 66 on your birthday, you will see a little bit of a rate bump. We sarcastically refer to this as a happy birthday increase. On top of that, you could see another increase when every year insurance companies are going to adjust for rising healthcare costs and inflation. So with attained age plans, there's a chance that you could see 2 rate increases in any given year. This is different than the other ways to underwrite supplement plans, but here in Maryland, you're attained age. It might sound like a bad thing, but attained age plans start lower than the other plan options. So the other plan options are issue age and community rated. So the lowest starting plans typically are attained age plans, then issue age start a little bit higher, but they don't have the happy birthday bump. And then community rated start even higher, and they aren't based on your age at all. So because you are an attained age state and you're a newer guaranteed issue state, that means that your supplement plan rates really aren't that bad compared to the national average and compared to other GI or guaranteed issue states. In states where there are guaranteed issue rules, you typically see higher than normal supplement plans because the insurance companies have to adjust for the risk they're taking on with you having the ability to switch plans around your birthday. Even if you have poor health, those plans have to take you, which means that they are taking on more risk for those who are in poor health. So you see higher rates. Nationally, if a 65-year-old were to want to get a Plan G, the average is $150 per month. Here in Maryland, it's $165 per month. Nationally, for a Plan N, you're looking at $120 a month. Here in Maryland, it's $135 a month. And you might be thinking, hey, that's higher, and it is. But in other states where there are guaranteed issue rules, it's typically even higher than that, and especially back east here. So in reality, you're looking at a little bit lower than normal GI rates here in the East Coast, which is a good thing. Now, with those costs, there are opportunities here to get even more discounts and lower those supplement plan premiums. So insurance companies, certain ones will offer discounts for certain things. So let's talk about 3 of them. The first is a household discount. If you and somebody in your household are on the same insurance company with a supplement plan, there are insurance companies that are willing to offer you a discount. So for example, let's say me and my spouse both get a supplement plan with the same company, then we would get a household discount. Another discount is called a wearable discount. If you're willing to wear a smartwatch like a Fitbit, a Garmin, an iWatch, and then you can sync that with the insurance company, there are certain insurance companies that will give you a discount for that because they can see that you're exercising and you're active. Finally, there are discounts if you're willing to pay your premiums for the whole year up front rather than month to month. And there are companies that will allow you to stack these discounts so you can kind of get all 3 of them. And this is what I'm always talking about. It's important to use an agent when you're looking for your plans because an agent can help, 1, find you insurance companies that are more stable. 2, they can help you find lower rates. And 3, they will know which of these discounts are available and help you and your spouse, if it applies, find and access these discounts. And I'm not even saying you have to use us, just use an independent agent who can offer both supplement and advantage plans to help you through this. It will never cost you anything. If you do want our help, I do have partners who are licensed and familiar with the plans here in Maryland. We'd be happy to do so. Now, when we're talking about supplement plans, we often look at the penetration rate. So how many people in Maryland are picking supplement plans? Well, nationally, the average is 21%. Here in Maryland, it's 24%. So slightly above average in the number of people who are choosing supplement plans over other options, things like advantage plans, FEHB, VA, TRICARE for Life, original Medicare only, or employer options. That's not me advocating for or against supplement plans. Those are just the numbers here in Maryland. Finally, to wrap up the supplement plan of this conversation, if you are qualifying for Medicare before you're 65, and this is coming because you're either disabled, you're diagnosed with end-stage renal disease or ESRD, or you're diagnosed with ALS, commonly referred to as Lou Gehrig's disease, you can qualify for Medicare pre-65, but there aren't a lot of supplement plan options available to you in most of the country, and Maryland is a little bit of an exception. Plan A is what you're going to be looking at, and it is a little bit expensive, but it's not that bad compared to the other states. So you don't get the full gamut of all of the letters of supplement plans available to you pre-65, and you do have an option that's not crazy expensive, but once you do reach 65, all of the plan letters open up to you, and you are seeing the same rates as everybody else who is 65. So if you are getting Medicare pre-65, your options are either this Plan A supplement plan, original Medicare only, a Medicare Advantage plan, or if you're under some sort of an employer plan, whether that's your employer or a spouse, then you can coordinate Medicare there with them. An important number that we look at from the Medicare Advantage side of things is called the maximum out-of-pocket. And you're familiar with this if you've been on any group plans, but this is your maximum risk in a given year. So once you meet your maximum out-of-pocket, the insurance company takes care of 100% of the charges above that for anything that is approved. Now, nationally, the average is $5,000 for the year. Here in Maryland, the average is $7,500. So you're considerably higher than the national average on the Advantage Plan maximum out-of-pocket scale. Again, this is an average, so there are plans that are higher than that, and there are plans that are lower than that, but you have higher than normal averages, and this might account for the Advantage Plan penetration rate. Nationally, the average penetration rate for Medicare Advantage plans is 50%. Here in Maryland, it is 22%. That is the third lowest in the entire country. Now, this could be because of that high maximum out-of-pocket. It could also be because of the prevalence of Advantage plans and how strong or weak they are in the networks that they cover. Plus, you do have a lot of government employees here that have other options, things like FEHB, VA, TRICARE for Life, plus the fact that you're a birthday state for your supplement plans and the rates are reasonable there. So those are kind of your options here. Again, whether it's a supplement plan or an Advantage plan, make sure you're working with an agent who can check your providers, check the hospital systems, making sure you're getting what you need. As a general rule, you will see stronger Advantage plans in more populated urban areas, and in more rural areas, you're going to see less competition than you would otherwise. So maybe not as many Advantage plans to choose from. All right, that wraps it up for the Medicare here in Maryland, but I always like to leave a secret keyword at the end of my videos just so that you and I can know that you've made it this far and I can take the comments a little bit more seriously. Now, when I think of Maryland, I'm a big basketball nut, and in 2002, I remember the Maryland Terrapins winning the NCAA championship with Steve Blake and Juan Dixon. So if you mention your favorite college, and it doesn't have to be sports, just your favorite college in the comments, then I'm going to know that you made it this far, and I can take those comments a little bit more seriously than those who haven't made it this far and that are bashing me in the comments. My family and I are going to go explore Maryland a little bit more, and thank you for making it this far. I will see you in the next video.